Welcome to today's Community Connections on New to Caregiving. As a reminder, you can enter any questions in the chat box, and this video is being recorded, so you can watch it at a later time. You can find it on the Community Hospice YouTube channel. I would like to introduce Erica White. Erica White is a licensed clinical social worker that has been in the helping profession of Stanislaus County for almost 25 years. Currently, she's a mental health clinician in our Hope Counseling Department, empowering individuals with family, mental health, and behavioral challenges to improve their quality of life.
Thank you, Priscilla. Hello, welcome. All right. New to caregiving, resources and support for those who are new to the caregiving role, or if you have a friend in that role, this could be helpful as well. Caregiving may be the most important job in our society. 21.3 of US adults, or about 53 million people, served as caregivers at some point in the 12-month review period. Taking care of a loved one can be incredibly rewarding. It can also be stressful, logistically daunting, and emotionally fraught. Let's face it, caregiving may be the most important job in our society, but please keep this in mind. This is the caregiver's Bill of Rights. If you're here in person, that's been included in your packet. If you want to go over that, I have the right to take care of myself. This is not an act of selfishness. It will give me the capability of taking better care of my relative. Things to keep in mind. I'll just go over a couple. I have the right to get angry, be depressed, and express other difficult feelings occasionally. The Caregiver's Bill of Rights are some suggestions to dismantle the preconceived notions and give permission to be kinder and gentler to yourself. If you are trying to be a superhero or as selfless as possible, please keep these in mind. I have the right to take pride in what I'm accomplishing and to applaud the courage it has sometimes taken to meet the needs of my relative. I have the right to expect and demand that as new strides are made in finding resources to aid physically and mentally impaired older persons in our country, similar strides will be made toward aiding and supporting caregivers from our county, from our towns, from our country, from our friends, family, and those around us. And the copy that you have in front of us even has an extra line to add what works for you, what you need from those around you. So in-home care, just in summary, is comfort in one's own home. It can include bonded and licensed companies that provide caregivers around the clock, outside agencies, and they provide personal hygiene assistance, bathing, dressing, etc. It may include those trained paid professionals, but it also may include laymen, daughters, sons, neighbors. In-home care can be services that are tailored to meet those individual and changing needs. In addition, in-home care, also known as home care, is non-medical care provided in the client's home. So that's what we're going to be talking about today. Not assisted facilities, although I'll briefly go over all those other options because you are still that caregiver role. If your loved one goes in a facility, you're still that companion, that advocate, that social worker. So that's also part of that caregiving role. Professional caregivers help many elderly adults remain at home from one afternoon per week or 24 hours a day, 7 days a week. So it takes so many variations. As we age, many of us would prefer to be at home or with our families, but sometimes we need extra help. With the growing numbers of older people who need support to live on their own, private and public organizations are now offering many different options in the home and the community. These options are often referred to as home and community-based services. So for example, while caring for a loved one at home, you may benefit from a crisis line, like the friendship line for caregivers and older adults. Call-in chat room, like Well Connected. Home modifications, like the program Dignity at Home. Personal emergency response system, like the Lifeline Personal Response Service through St. Joseph's, or even the Medic Alert program. has supports in this area. There's also food delivery and on-site distribution centers, and that phone number is to the Area Agency on Aging. So multiple companies can deliver food at home. They have multiple distribution sites where you would pick up meals, and they also have those congregation sites where your loved one, if they're still mobile, can go and converse and socialize with their peers while eating. A good place to start if you find yourself suddenly in that caregiving role is to download the Community Hospice Caregiver Toolkit. So if you're here today, that's in front of you. You will then be able to assess your needs, their needs. That can be found on our website. And it's just data collection. If you are sharing this task on a shift basis with your friends and family and neighbors, it would be that one-stop guide that they can see what medication our loved one is on, what their preferred hospital is, if there's a do not resuscitate order, if there's a pulsed order, what our role is. If there's an emergency, would you be calling 911 or would you be calling a social worker? Many people are unsure where to start when caregiving for their loved one. And if it becomes too difficult, it can be stressful and overwhelming to find the right living solution to meet their needs. There are many options available that provide a safe alternative to home when caregiving becomes too difficult. So in addition to inside the home with maybe respite or paid caregivers, like I said before, you may be a caregiver that supports someone in a facility. So this is other caregiving options where you would still play that role in their life, a very important role. Residential care, room and board and care, skilled nursing facility, memory care if you need that more specialized care, or researching the needs of the palliative option of your hospital or your local hospice agency, or like community hospice has, and hospice care. So these are just layers and layers and variations of support someone might need. So in the home, community agencies and resources may help via support groups, such as VIPs if we are struggling with vision. Support groups that the Alzheimer's Dementia Center provides, the Valley Caregiver Resource Center provides. Friends Are Good Medicine, that's the Stanislaus County guide of our local support groups. It may also look like food, like I said, congregate lunch sites at various locations, home delivery, the Stanislaus Green Bag program for produce. It may include home modification or durable medical equipment provisions. Drail is a great agency for that. They might modify, they might be able to add, they might be able to change the equipment that you have, such as needing the TTY machine. If you need phones with and the larger dials, you can look into Drail. And CTAP, it's a California Telephone Access Program. So look into that website and see if they can get you a free phone with for hearing augmentation and for vision augmentation. Another program is Dignity at Home, and they may be able to assess your home and see if you need grab bars and see if you can modify that. And also, like I said, VIPS does that as well. So here's some local information, resource, and referral lines that will probably have phone numbers for all of those programs. Don't forget to explore respite options such as the Family Caregiver Support Program and in-home support program, in-home support services. Some of these programs are based on need and health insurance and income. So just give a call and see which one fits your needs best. Respite would be available in order to schedule your own self-care or wellness appointments. If you find yourself needing placement assistance, there's programs such as A Place for Mom, Golden Placement Services, and Provident Care. So they would have the most up-to-date information on what beds are available to meet your needs in the area. So this is the community resources that I quickly went over and some of those phone numbers. Family Caregiver Support Program for respite. The Friendship Line, that's a 24-hour support line for caregivers and older adults, so we can avoid that loneliness and isolation. In-home support services, mostly for Medi-Cal beneficiaries, in order for you to either choose a neighbor or a friend that can provide care and be paid for it, or if you don't have that available to you, you can call that social worker and request a list. The area agency on aging, that is a one-stop shopping that's going to have those phone numbers, and they also house and do screening for a lot of those programs. So if you only remember one phone number today, it's going to be that 209-558-8698. They're going to have the most up-to-date resources for our seniors. The Move Bridges program, that assists in travel training, helping our loved ones learn how to use public transportation, like how to access Dial-A-Ride and get certified in order to use that. The Bridges program is a mileage reimbursement program. So if you're providing your loved one trips and driving assistance to go to their medical appointments, you may be able to be reimbursed for doing that through the Move Bridges program. Veterans Administration, for example, aid and attendance, that also may provide you with financial support if you're caring for a veteran. HICAP is our Medicare liaisons. I talked about that hat that you wear as a social worker. Sometimes you're on the phone a lot trying to figure out Medicare Part A, Part B, Part D. What's that prescription drug plan that they're on? What's the best one to enroll them in this upcoming January enrollment period? That HICAP program is going to be your best bet for those questions. The Healthy Aging Association, they provide a lot of exercise classes, nutrition classes. They have even home, chair yoga, Tai Chi, strength training, very soft, low impact, where you can go and make some friends and enjoy that camaraderie. A lot of those classes are free. Those are advertised in our senior center on Bodum. A lot of them happen there. They're also in our most recent City of Modesto Parks and Recreation Guide, because they're offered throughout the area, even Oakdale series. So contact them, maybe get on their mailing list for their most recent newsletter and see what they're offering. There's that Dignity at Home. You see that it's screened through the Area Agency on Aging. That phone number looks familiar. So that's that home modification program. So again, research those and see if you need that home and personal care, meal services, companion and telephone reassurance services, personal emergency response system, senior centers. They also do arts and crafts and a lot of things other than exercise there. Transportation and respite care. That well-connected program that I talked about earlier, it used to be called Senior Center Without Walls about 15 years ago, which I think is a good description of it. But the website is covia.org, and it's like phone call chat rooms. So you can call and talk about old movies. You can listen in on ongoing conversations about bird watching, knitting. So they provide if you go to that website, like a catalog, as if you're enrolling in like college courses. So if your loved one is just feeling lonely and not connected, another good program to avoid that loneliness and that lack of connection is the Friendly Visitor Program, again, called the Area Agency on Aging. That would be someone coming to the home, maybe reading local current events, reading the newspaper, playing bridge or checkers. So reading the newspaper, playing cards, kind of maybe doing some art programs. That's the Friendly Visitor Program. Another similar but very different program that would also be through the Area Agency on Aging is Project Hope. So that's a more clinical visitor, like a mental health clinician, that would help if your loved one is experiencing a little more than loneliness. It looks depressive. It looks like depression. They're not wanting to connect with anybody. They don't want to engage with anybody. They don't want to get dressed. They don't want to get showered. Maybe they might need a higher level of care in that regard, not just companionship, but some mental health counseling. Catholic Charities, Social Services, they have a lot of programs under that umbrella. Some of it is domestic assistance, light housekeeping. Some of it is transportation, if you're not able to take them to their medical appointments. Okay, some references on just what I talked about, my statistics, and that list of home and personal care, the needs of our loved ones that need care. I got that from these articles. So I hope it's been really helpful to you. I can answer some quick questions. I brought some of those brochures about agencies that I spoke about if we need to delve in deeper about what they do.